Hi there, I'm Teresa Dufour with the CT Style Express report. So back to school time has arrived, but this year we know it's drastically different because of the pandemic. So how can you keep your kids safe and still send them to school? Here with some answers is CEO of Docs Medical Group, Dr. JD Sadana. Doctor, thank you for chatting with us today.
Hey, hi Teresa, thanks for having me here.
Before we get back to school topic here, talk to me a little bit about Docs Medical Group and what you're all about.
Got it. So Docs Medical Group is essentially a chain of urgent care clinics. We have 18 clinics throughout the state of Connecticut. And we also, apart from the urgent care aspect of it, Docs Medical is now transitioning towards a multi-specialty group. So we have various different specialties, including internal medicine, so for primary care needs, cardiology, pulmonary, sleep medicine. But a lot of what we've been doing over the course of the past few months, of course, has been COVID-related, COVID-centric, and doing a lot of testing related to COVID over the course of the past few months, which is absolutely the need of the hour. So that's what Docs is all about. We've been in existence since 2009, and we're here to serve our communities.
Sure. And Doctor, as an expert in this field, what advice do you have for parents, or how can you prep parents for sending their children back to school safely?
Absolutely. That's an excellent question. So one of the things to understand is that conceptually, this is a healthcare problem. So a healthcare problem should ideally have a healthcare-based solution. So a lot of what I'm seeing right now, and we consult with various school districts where we are having conversations with them as to how they should be reopening their schools. A lot of what we are seeing right now is that there is guidance from the state government. However, the guidance from the state government allows it to be somewhat of an open-ended book, whereby every school and every school's administrators and their consultants are kind of deciding whether or not kids should be sent to school, what should be the pattern of how kids should be sent to school. And everyone in their right mind is trying to do absolutely the best they can for their community. So there are schools which are opening for 2 days, there are schools which are opening in a hybrid model, and there is a lot of uncertainty in general because there is not a whole lot of consistency in how different schools are opening. So with regards to parents, I completely get it as a parent myself. I have a 10-year-old and a 4-year-old. I completely get it in terms of being unsure whether or not, firstly, we should even send our kids to school because, what is the likelihood that we've been self-isolating, or we've actually stayed in this bubble of ours very nicely over the course of the past few months? This becomes an uncontrolled environment where kids are going back to school. And what if they actually bring back COVID? So the first things for parents to understand is, and the first question for them to answer is, does the family have any unique susceptibilities towards COVID? Are there elderly parents who are co-inhabiting with you? Is there somebody in the house who has an underlying immune disease? Is there somebody in the house who may have underlying cancers, or is it a higher risk to begin with? Because for those families, the decision becomes different than the decision is for everybody else who's involved here. So those families have to make a very individualized decision to say whether or not we want to expose ourselves to COVID by sending our children or grandchildren to school. But for everybody else, I think the decision really has to be made based on a few specific factors. The first specific factor, which is Connecticut-centric, is what is the positivity rate of people who are getting tested currently? So if you look at the test positivity rate, which essentially means the total number of positive test cases divided by the total number of tests which were done. So in March and April, when we initially had the onset of COVID, we were being judicious, and we had a limited supply of testing. And we saw there was a period of time where we were seeing up to 12 to 14% of people who were tested ended up being tested positive. Now that positivity rate is down to 1 to 1.5%. And what we're also looking at is that the community-based spread is very limited. So if I factor in both of those things, the test positivity rate and the community-based spread, it seems to be relatively safe for our kids to go back to school. Now, there are two other factors which then get involved here. Well, what is the specific policy that a school is following? What guidelines and what steps is the school taking to mitigate the spread of COVID within the school system itself. Are kids going to have regular physical activities? Are there going to be contact sports? Is there going to be phys ed classes? Is there going to be a shared dining space? All of those things which we shudder to think about as to how this could be a petri dish for this infection to spread. The other thing itself is, what is the density of students in each classroom? Is it the regular size classroom? Are the classrooms reduced in size? So those things, which are very school-specific things, have to be tied in to what's happening in Connecticut in general as to what is the test positivity rate. So if there is a community, for example, Danbury, Connecticut, we recently heard that there is a heightened increase in cases there. So that needs to be addressed differently than any other city or town in Connecticut, purely because of the fact that once we've identified there's a higher number of cases, and that does not mean that kids in Danbury should not be able to go back to school. All it means is we need to have a better assessment of what is their risk stratification, how likely is the infection to spread in those communities. Sure. But overall, when we look at Connecticut, the numbers are low enough for kids to go back to school. Yes, it needs to be done in a safer manner. And yes, families also need to make decisions based on what is happening within their household and whether or not there are unique circumstances which impact their household itself.
Absolutely. I know we're just hitting the tip of the iceberg here, but such important information from a medical professional. We appreciate the insight on it. And of course, rapid testing plays a big role in this. That's available at Docs Medical Group, and you can learn more over at your website, docsmedicalgroup.com. I know you have locations all across the state, so we'll be sure to check you out. Doctor, we appreciate your time today.
Thanks a lot, Teresa.